Good morning, and welcome to the 2024 Annual General Meeting. My name is Ann Priestman. I've been involved with the college as a board member since 2015. I'm currently serving my fourth year as the board's president and chair. I'm a specialist in internal medicine and endocrinology and metabolism, and have been practicing for more than 25 years in New Westminster. I would like to begin by acknowledging that this annual general meeting is being chaired on the unceded and traditional territory of the Coast Salish peoples, including the territories of the Hunkaminam speaking peoples, the Musqueam and the Tsleil-Waututh nations, the Squamish-Snitcham speaking peoples, the Squamish Nation. I also acknowledge that all of you attending today remotely are located on territories of First Nations across this great province. We acknowledge the rights and title of BC First Nations whose territories span across the province. These territories recognize that laws, governance, and health systems tied to lands and waters have existed here since time immemorial. Participating with me today during these proceedings are Dr. Patrick Rowe, Registrar and CEO, Mr. Graham Kierstead, Chief Legal Counsel and Deputy Registrar of Legal, and Mr. Mike App, Chief Operating Officer. I will now call the 2024 Annual General Meeting to order. I declare that we have a quorum of registrants in virtual attendance and that we are duly constituted for the transaction of our business today, which includes adoption of the minutes for the Annual General Meeting on September 22nd, 2023. Presentation of the board-approved audited financial statements for the period ending February 29th, 2024. Appointment of the auditors for the current fiscal year. An in memoriam for registrants who passed away during the past fiscal year between March 1st, 2023 and February 29th, 2024. A president's report, followed by a word from the registrar, and then other business and questions from registrants, after which we will conclude this annual general meeting. For those of you joining by video, if you have a question during the proceedings, please use the Q&A feature found on the ribbon at the bottom of your screen. You can ask questions at any time, and we will answer them when we get to other business. I will now ask for a motion to adopt the minutes from last year's annual general meeting held on September 22nd, 2023, as published on the college website. I invite you all to cast your vote by selecting one option on your screen and clicking Submit. Here are the results. 83% have approved the minutes. The audited financial statements for the year ending February 29th, 2024 have been approved by the board and have been published on the college website. Just as a reminder, if you have a question about the audited financial statements, please use the Q&A feature found on the ribbon at the bottom of your screen, and we will answer when we get to other business. I will now ask for a motion to approve the appointment of KPMG LLP as auditors for the current fiscal year. I invite you all to cast your vote by selecting one option on your screen and clicking Submit. Here are the results. 90% have approved the motion. I will now ask for a moment of silence to remember and pay respect to registrants who passed away during the fiscal year between March 1st, 2023 to February 29th, 2024. Thank you. This year has been a period of transition for the college. With current unrest around the globe, rapid technological advancements such as artificial intelligence, and upcoming legislative changes for BC health regulators, it is important that we be proactive, agile, and keep pace with a changing world. I'm pleased to share with you the college's progress and accomplishments from the past year, and some reflections on the work still to come. In July, BC's Provincial Health Officer, Dr. Bonnie Henry, announced that the public health emergency for COVID-19 was formally ending. I would like to take a moment to thank all of you for the work you did to support patients through a difficult, generation-defining time. I also want to recognize that although the public health emergency has ended, you continue to face complex challenges in healthcare delivery, including a province-wide shortage of health human resources. We are grateful for your resilience and professionalism in the face of these challenges. I would like to introduce and welcome Dr. Patrick Rowe to his first annual general meeting as Registrar and CEO. Dr. Rowe brings over 30 years of experience as an emergency room physician, and before assuming his new role, he sat as a college board member for 10 years. He shares the board's deep commitment to continuing our work towards advancing culturally safe care and innovation in a changing regulatory landscape. We are grateful for Dr. Rowe's leadership. This year, the college began planning for the transition to the Health Professions and Occupations Act, which will replace the Health Professions Act in 2025. The HPOA lays the groundwork for transforming how health regulators will fulfill their public protection mandate. It will improve patient care by implementing anti-discrimination practices, supporting and promoting awareness of reconciliation with Indigenous peoples, creating a more transparent complaints process, and establishing a new oversight body for regulatory colleges. While the HPOA will transform health regulation in BC on a systems level, many of the processes and operational touchpoints through which registrants interact with the college will remain the same. We look forward to collaborating with the Ministry of Health and other colleges to advance a regulatory framework that is firmly focused on quality patient care and well-being. Please be assured that Dr. Rowe will provide registrants with regular updates over the next year as we progress with the HPOA transition. The college continues its work to ensure that Indigenous patients in BC are receiving culturally safe care. We recently assessed registrant awareness and application of the Indigenous cultural safety, cultural humility, and anti-racism practice standard, which was launched in 2022. The evaluation demonstrated that we need to do more to raise registrants' awareness and understanding of the standard and provide concrete examples of how to apply it in practice. The college's accreditation programs have also adopted standards for providing culturally safe and anti-racist care for Indigenous patients in college-accredited facilities. These standards apply to both registrants and non-registrant staff. We have a goal to recruit more Indigenous people to governance and leadership positions. The college currently has 4 board members, including 3 appointed public members and 1 physician member, and additional committee members who identify as Indigenous, but we need to do more to ensure that our decision-making considers those who have historically been underrepresented. As part of our cultural safety and humility work, we also must understand the barriers that Indigenous peoples face when accessing the college. In 2023, we completed a review of the college's complaint process to identify opportunities to make it safer and more accessible to Indigenous peoples, which resulted in 11 recommendations. I'm pleased to report that work to implement the recommendations is either in progress or complete. Actions completed to date include modifying the complaint form, providing an option for complaints to identify their racial and cultural identity, and reporting on complaints of Indigenous-specific racism in our annual report. The Complaints Department has also hired an Indigenous Pathways Development Lead to assist with building connections and authentic relationships with Indigenous people, communities, and leadership. The widespread health human resource shortage is a complex issue, and we share concerns about its impact on registrants and patients. The college will continue to collaborate with the Ministry of Health to mitigate the issue by streamlining registration processes and creating new pathways to licensure. Last year, we introduced a licensing framework for qualified physician assistants to work under the delegation and supervision of physicians in emergency department settings. There are also bylaw amendments in progress related to the new associate physician and USA certified classes, allowing more international medical graduates who are not eligible for full or provisional licensure to work in BC. The college recognizes the need to support registrants in meeting high standards of medical practice and conduct. As part of this work, the college develops practice standards with input from registrants to ensure they can be applied in clinical settings. In April, the college published Ethical Principles for Artificial Intelligence in Medicine to help registrants understand the college's position on responsible use of AI tools in medical practice. The Drug Programs Department aims to support registrants in prescribing safely through their careers. As antimicrobial resistance is on the rise nationally and globally, Drug Programs now offers resources on antimicrobial stewardship. Registrants are encouraged to request a personalized antibiotic prescribing report to assist in optimizing their approach to antimicrobial prescribing and enhancing the care provided to patients. Support is also offered to registrants through the Physician Practice Enhancement Program, or PPEP. 10 years of PPEP data has shown most registrants are performing very well and may benefit from having diverse assessments. PPEP has restructured and now includes 3 assessments to better support different registrants with unique practices: peer, self-directed, and office. PPEP also expanded assessments to include anesthesiologists and those providing family practice anesthesia in dental facilities. The restructuring of PPEP is an example of how we continue to evolve the way we support registrants in their ongoing commitment to quality improvement. The college also offers services and resources to support registrants in applying the standards, including brief, self-directed online courses. This year, new courses were launched on medical record keeping, safe prescribing, and informed consent. These courses are intended to extend beyond practice standards, encouraging registrants to reflect on how they can comply with college expectations. The college also continues to offer registrant support coaching. 2 experienced retired family physicians certified in coaching are available to registrants by appointment. And finally, the college has launched Connecting the Dots, a podcast covering relevant and pressing topics in medical regulation, featuring guests who are at the forefront of dealing with healthcare issues in BC. If you have not already taken the opportunity to access these resources, I encourage you to do so. They are all available on the college website. At its retreat in July, the board dedicated time to considering its priorities for the coming years and is currently developing an updated strategic plan for 2024 to 2028. The plan will outline 4 clear strategic themes that focus on anti-discrimination and anti-racism, enhanced engagement, Indigenous relations, and innovation and change. We look forward to finalizing the strategic plan and providing registrants with more details about our future objectives. That concludes my report. Thank you again for attending today. I will now turn it over to Dr. Patrick Rowe to say a few words.
Thank you, Dr. Priestman, and thank you everyone for attending. I'm going to start by highlighting how grateful I am and how delighted I am to be here at the first AGM as the Registrar and CEO. I'm grateful to our staff, to our partner organizations, to registrants. I've had a warm welcome since I've started in this role last December. As Dr. Priestman has described, we have a lot of important work ahead of us. We have the anticipated transition to the Health Professions and Occupations Act, which Dr. Priestman has spoken to, and will be significant for the college and for health regulation in BC. My priorities are twofold. One, to continue the essential work we have already started to advance cultural safety and humility in healthcare, and to do our part to address the health human resource challenges in the province, partly by helping to create new pathways to licensure. As a clinician for 30 years, and as all clinicians out there like me, I have a deep appreciation for the needs of patients, but I also have a clear understanding of the difficulties that physicians face when meeting those needs. However, over the past 10 months working at the college, I've seen an organization that is capable of shifting and responding to change, while always keeping focused on public safety. I'm incredibly confident that the college is perfectly positioned to evolve and achieve the goals that Dr. Priestman has outlined. I'm hoping to connect with many of you over the next few months or the coming months to ensure that we have a common understanding of the role of the college in the broader healthcare system, to collaborate on shared initiatives, and to find solutions for the challenges that you're facing in providing quality medical care to patients that I know all registrants are striving to achieve. So thank you, Dr. Priestman, for this opportunity to introduce myself, and thank you everyone for joining us today.
All right. Thank you, Dr. Rowe. I will now open the floor to any other business or questions. And just as a reminder, if you do have a question, please use the Q&A feature found on the ribbon at the bottom of your screen. Have we got any?
Yes, Dr. Rowe, Dr. Priestman, there is one question here from Ryan McCallum with regards to remuneration of panel members. I wonder if that's not something that maybe should be sent to the board, but wondering if there's any thought in given to paying panel members for the time spent in preparing for meetings.
Maybe I'll turn that to Dr. Rowe. Oh, you're muted, Patrick.
Thank you, Anne. The decision around honoraria fees for all panel members, whether they're physicians or public members, is an annual decision that takes place. It's through input from the Finance Committee and from the staff that support those committees. And then those decisions around honoraria are ultimately taken to the board for a final decision. So it's a good question around how do we fairly remunerate panel members. The college is committed to fair remuneration, and we do review it regularly. And by that, I mean at least annually, if not more frequently. Then the Finance Committee and the board are highly attuned to all of our honoraria rates, not just for panel members, but in fact for all of the other services that we receive from contractors and from registrants and the public in our various functions. So it's a very, very good question, and I can assure the person asking that we take this piece seriously, and we in fact review these honoraria rates on a very regular basis. Mr. Epp, did you have anything you wanted to add?
No, just to be a little more specific in terms of the timing, we actually review the honoraria rates at the November Finance Committee meeting, and then that recommendation gets taken forward to the board. So I'm more than happy to take this comment forward to the Finance Committee. The issue of payment for prep time has been reviewed a couple of times by the Finance Committee and the board, and they've chosen to not do that to date, but it's something that we can certainly look at again. And I know that we do regularly compare our honoraria rates across the country with our peers. And I believe the last time we looked, we had about the second highest rates in the country. But that doesn't mean that we don't need to continue to look at it. And as I said, I'm happy to take it back to the Finance Committee in November.
Do participants have any further questions for Dr. Priestman or Dr. Rowe? Please feel free to type your question in the Q&A feature. I'm not seeing anything further.
In which case, if you do have questions and you want to send them to communications@cpsbc.ca, that is certainly an option, and we will direct it to the appropriate person to give you the best answer we can. But otherwise, we will conclude the 2024 Annual General Meeting, and the minutes from this meeting will be posted on the college website. Thank you once again for participating in this virtual meeting today.